Good evening, doctors. Welcome again. Myself, Dr. Hemant. As you all know very well, I already put Neet PG 4-hour video part 4, and this is our part 5th. Today we are going to discuss. Okay, these are very high yield. So this is the 5th part. I have total 12 parts. So let's discuss. A male have excess desire of intercourse. This is known as satyriasis. But what is nymphomania? Nymphomania is an excess desire in a female, sexual excess desire. Voyeurism is what lot of people likes to watch porn. They are getting pleasure by seeing a sexual activity with others. Bestiality. What is bestiality? It's an intercourse with human being and animal. This is known as bestiality. Okay, let's discuss such kind of disorders in details. Like pedophile. Pedophile is an adult experiences sexual attraction to a prepubescent child. I hope it's clear for you. Pederast, man who desires or engage sexual activity with a boy. Catamite, a boy or youth who is sexual relationship with a man. Okay. Now, granatophile, grandparents or granatophile, it's primary sexual attraction towards the elderly peoples. Okay. Most common site tear in case of female masturbation or in case of rape, that is 6 o'clock hymen tear. Sin of Gomorrah means buckle in coitus. Bestiality, as I explain you, it's an sexual activity or intercourse with animals. This is intercourse with animals. Sodomy, oral and anal intercourse between man and animal. This is known as sodomy. Tribadism, rubbing vulva between two women against her partner body purpose to getting a sexual pleasure. Okay. And what is transvestism? Trans, Transvestism. Transvestism means a male feeling happy after wearing a female clothes, or a female like to be a male, she likes to wear his clothes. That is transvestism. Okay. Tribadism is clear for you, rubbing vulva. Now, homosexuality, it's man with man between man, that is gay, woman between woman, that is lesbian. Nowadays in India, new law, that is not a crime. Okay, gay and lesbian marry. Sex with cadaver or a dead body is called necrophilia. Exhibitionism disorder. Exhibition means exposing one's genitalia or sexual organ to non-consenting person. This is known as exhibitionism. Okay, I hope it's clear for you and you are really understanding well. Undinism. It's known as sexual arousal, especially by urination. Voyeurism, as I already explained, sexual pleasure from observing other people's. This is known as voyeurism. Sexual gratification by inflicting pain on partner, it's sadism. Satyriasis is an excess sexual desire in a male. This is known as satyriasis. Now, frigidity. Failure of female to achieve orgasm during sexual intercourse. This is known as frigidity. Nymphomania is an increased sexual excess, uncontrolled desire in a female. Okay. Clismophilia means sexual gratification obtained by anima. Okay. Masochism is a sexual gratification obtained by self-pain, self-inflicting pain itself. This is known as masochism, and sadism is a pain given to a partner during intercourse. Okay. Now, fetishism. This is known as sexual fixation of non-living objects to a genital part. Cumnilingus is a oral sex performed on female genitalia. This is cumnilingus. Such disorders. Okay. Now, adult spinal cord ends at adults end at L1. I explain everything. L2 for children, L3 for infant and neonate. So, adult L1, spinal cord and children L2, and infant and neonates it's L3. Okay, Turner syndrome true about 45XO and 46XX is Mayer-Rokitansky-Kosher-Hoster syndrome. 46XY this is testicular feminizing or androgen insensitivity. 47XXY it's Klinefelter syndrome. So I explain everything, all four options. Okay, you have to memorize in such a way. Okay, let's discuss Mayer-Rokitansky-Koster-Hosher syndrome. This is 46XX with one ovary, also known as Mullerian agenesis, absent uterus, and cervix absent, hypoplasia of vagina. There is primary amenorrhea, symptom talarch, adenarch, and pubic hairs are there. Pregnancy by IVF, in vitro fertilization, or by surrogacy. Hope it's clear for you. Let's discuss more. Okay. Androgen insensitivity syndrome or testicular feminizing 46XY. Female phenotype trait means she is looking externally female. Okay, that syndrome looking externally female, बाहर से female की तरह दिखना. But male genetic makeup, but internally a male. Okay, internal inside male. Unresponsive to androgen male hormone. No uterus, no fallopian tube, and no ovaries. But in Mayer-Rokitansky, ovaries were there. Short blind pouch of vagina, there is hypoplasia of vagina. Testes in inguinal canal or abdomen, no pubic or axillary hair, but their axillary hairs are present. Now, discussing about testicular feminizing syndrome, individually primary amenorrhea, yes, cannot bear child. Riefenstein syndrome cannot be a child, breast development, gynecomastia, micropenis, and hypospadiasis. This is also known as testicular feminizing syndrome. Now, Kalman syndrome, failure of hypothalamus to release GnRH. Okay, hypogonadotropic hypogonadism. That's why decreased testosterone in male and decreased estrogen and progesterone in female. Absence of LH and FSH. Okay. Let's discuss more. Guys, if I am fast, please tell me in the comments. In next video, I'm going to be slow. Sayer syndrome, it's 46XY. Female phenotype gonadal dysgenesis with Mullerian system. 46XY is androgen insensitivity also, but in Sayer syndrome, this is female phenotype, same like the androgen and gonadal dysgenesis, but with patient with Mullerian system, but they are no Mullerian system. Okay. Now discuss Klinefelter syndrome, that is 47XXY. We see gynecomastia, infertility, hypogonadism, small testes, X-linked recessive, bar bodies, and FSH increases. This is known as Klinefelter syndrome. Okay. Now Turner syndrome, 45XO, primary amenorrhea, infertility, streak ovaries, coarctation of aorta. Congenital heart defect is coarctation aorta in Turner syndrome. Short stature, absent breast, no breast. And in Turner syndrome, no mental retardation. Remember, no mental retardation. Mental retardation present in where? In Down syndrome on 21 chromosome. Like, we have to discuss this MCQ. I'm going to make it short little, that's why visible all four options. Okay, let's see. Mullerian agenesis, yes, no uterus, no cervix. Insensitivity to syndrome, 46XX syndrome. So this I am going to say this is Mayer-Rokitansky Kosher-Hoster syndrome. Why? Because there is 46XX chromosome in Mayer-Rokitansky, Mullerian agenesis there, so this is Mayer-Rokitansky. Now second we read female phenotype 46XY, absent Mullerian system. This is known as androgen insensitivity or testicular feminizing. So this is androgen insensitivity. Okay, A answer is second. Now, third one we are going to read hypogonadotropic hypogonadism with anosmia, that is Kalman syndrome. Now, fourth, female phenotype with 46XY gonadal dysgenesis with patient Mullerian symptom, Mullerian present with Mullerian, that is Sayre syndrome 46XY. Okay, so I hope it's clear for you. Yes, let's see. Same. A is second, B is first, C is fourth, and D is third. I hope it's clear. Treponema syphilis, name given by Shodin and Hoffman. I already explained syphilis in a Neet PG fourth part video, so please watch that. Everything I explained there. Now, most common nerve injury during shoulder dislocation is axillary. Okay, leprosy nerve, also known as ulnar nerve. Best nerve to used to monitor anesthesiologist is ulnar. Which nerve is secretomotor to lacrimal gland, that is facial. One more thing I am going to explain about nerves. Ape thumb, median nerve. Claw hand, ulnar nerve. Okay. Wrist drop, radial nerve, remember. Okay. Help syndrome. This is H, hemolysis. EL, elevated liver enzyme. LP, it's low platelet. Okay, remember this. Large and pink tongue, where we are going to see in vitamin B12 deficiency. B12 absorbed from where? Terminal ileum. Terminal ileum. Okay. B12 causes which kind of anemia? It's megaloblastic, macrocytic, and hyperchromic anemia. MCV size more than 10, and MCH size, MCH color more than 32. Drug of choice in BPH with hypertension, that is prazosin. Drug of choice in scorpion bite, that is prazosin. Drug of choice in BPS, that is tamsulosin or sildosin. Okay. Now, drug of choice in pheochromocytoma, that is phenoxybenzamine. Drug of choice in cheese reaction, that is phentolamine. I am going to explain why this is. Drug of choice in clonidine withdrawal, that is phentolamine. Okay, let's discuss about this. Okay, I hope till here it's very much clear for you. Let's discuss more in deeply. Alpha adrenergic blockers. Alpha receptors are two types, alpha 1 and alpha 2. Alpha blockers are mainly three types. Alpha 1 plus alpha 2 blocker, this is known as non-selective. Alpha 1 blocker, this is known as selective blocker. Alpha 2 blocker, this is selective. Euhimbin, no clinical use nowadays. Okay, no clinical use still now, so I'm not going to discuss or going to be in more details about this drug. Alpha 1 causes vasoconstriction, so we are giving here inhibitors, so this causes vasodilatation, and when vasodilatation occurs, what happens? BP down. So treatment of hypertension, we are going to use alpha blockers. Alpha blockers non-selective versus selective, decrease BP, alpha 1 in both. Okay, now I'm going to make in such a manner. Okay, more easier for you. This is presynaptic, synaptic membrane. So presynaptic, if we block alpha 2, if we block alpha 2, that means noradrenaline releases act on alpha 1 and beta 1. If noradrenaline releases when nerve impulse, act on it. Okay. Now noradrenaline act on both alpha 1 and beta 1. Beta 1 here, alpha 1 here. If we block both alpha 1 and alpha 2, then it act on beta 1, causes tachycardia and palpitations. Okay. Now alpha 1 plus alpha 2 used for severe hypertension and alpha 1 used for mild to moderate hypertension. Why so? I am going to explain. If alpha 2 we block this, we block this. Okay. So what happens? It is alpha 1 also block. So noradrenaline not releases, so it causes what? Severe hypotension. But if we block only this one, alpha 1, alpha 2 is normal, so noradrenaline releases, it act on alpha 2 and beta 1 receptors, so there is not so much decrease in BP. Non-selective alpha blocker, alpha 1 plus alpha 2, that is irreversible, another one is reversible. Irreversible means a prolonged action, long effect, long term. So we are going to use to decrease BP, that is phenoxybenzamin drug in pheochromocytoma. Okay. But reversible drug we are going to use for short term, short duration, that is phentolamine, tolazoline in cheese reaction and colonidine withdrawal. Okay. Now what is cheese reaction? If we eat cheese, it contains tyramine. When it goes in our GI tract, we have monoamine amino oxidase which metabolized and it break down the tyramine. But in some cases, MAO inhibitor used in depression. Those patients on MAO inhibitor, if they eat cheese, the tyramine not able to metabolize, it causes severe hypertension. Okay, so those who are on clonidine alpha 2 agonist, okay, this is alpha 2 agonist drug. Alpha 2 works to break, it apply break on this for control BP. Okay, if do not have alpha 2, it's block alpha 2, that means the BP decreases. Okay, now stop clonidine 160. And clonidine, what was done there? Clonidine block the alpha 2. If it block the alpha 2, that means BP drops. Okay, so stop clonidine when the BP is 160. It clonidine use make BP into 120. If we stop clonidine immediately, then the BP raises up to 220. Very, this is known as rebound hypertension. Okay, selective alpha 1 blocker we are going to use like prazosin, trazosine, doxazosin, alfuzosin in hypertension with BPH patients. Alpha 1 act on prostatic urethra which decreases outflow, and if we are going to use alpha 1 blocker, that means it increase urine flow, treatment of BPH. Okay, drug of choice for hypertension with BPH, that is prazosin. Side effect: first dose hypotension and postural hypotension. First few doses lying to sitting, no problem. When stand up, then there is a problem. Okay, it causes postural hypotension. Only BPH treatment, the drug which alpha 1A act on prostatic urethra, that is tamsulosin, sildosin is a new drug. It least chance of causing postural hypertension. But alpha 1 that act on B cells, that act on blood B for B, it acts on both BPH and hypertension, that is prazosin, trazosine, serrazosine. So I hope guys it's clear for you. If you want to see adrenergic alpha blocker, if you think that I am very fast here, so you can watch my lecture, alpha adrenergic blocker lecture by Dr. Hemant. You can write and you find me there, and that will, there I am explaining slowly and gently, but here I need to finish fast for you to revise very clearly. So guys, I want to say thank you for watching this lecture, and I really, I'm very help want to say thanks for you for your all love and for your nice comments. And if you still not subscribed my channel, please subscribe it. This video really helps you a lot, a lot. You are definitely going to receive some questions from Neet 2019 exam 4-hour video. So please continue watch all parts. Thank you, good day, goodbye, and that's all for today. Okay guys.